Hi everyone, today I'm honored to be joined by Dr. Kirsner, the chairman of the Department of Dermatology at the University of Miami, and today we're going to be answering some of your questions. First question, you've held many important roles in academic dermatology. What originally drew you to dermatology and wound healing specifically?
When I was a medical student like you are, I was exploring different specialties, and I decided that I wanted to go into a specialty that one had a depth. I wanted to know a lot about one area as opposed to being a generalist, and I also wanted to get involved in a specialty that was important to the patient. I thought about a few, but I landed in dermatology, in large part because as I was exploring them, dermatologists were happy with what they were doing. They enjoyed their work, and I thought, well, that's a pretty good area that I should learn more about. As I went through it, I really became fascinated with the skin, how it functions, how it has many different aspects of what it does. It protects, it has an immunologic system, it's involved in wound healing, it's involved in aesthetics, and it's really a complex organ that you can easily access to study and learn not just about how the skin works, but how the body works in general. At the time when I was a student, the chair was someone who was a leader in wound healing. And I thought to myself, why not get involved with the expertise of the department that I was going to medical school at? So the fellow's name was Bill Eaglestein, and I was offered a fellowship in wound healing, and I did a 2-year fellowship in wound healing, and that kind of launched my career. And wound healing is great because it combines medicine and surgery. You have to have a medical mind to make diagnosis and know the the complete spectrum of things that can cause ulcerations in the skin. But at the same time, you're debriding, you're doing skin grafting, you're doing all sorts of surgical techniques to help a wound go to closure. So it's the combination of sort of using both sides of your brain that really was fascinating for me.
Yeah, I think you brought up a great point in the beginning about dermatology, being so all-encompassing. As I've learned throughout my courses so far, a lot of the, deeper issues, whether it be like the liver, the kidneys, a lot of the signs you'll see on the skin. So maybe a dermatologist that'll be referring you to a deeper issue. So I think it's really interesting, and that's why I've loved the field, the exposure that I've had so far. Second question, what lessons have you learned as chairman that you wish you knew earlier in your career?
Well, I think the one thing that I'm different as a chairman than I was earlier in my career, and I don't know that I wish I was like that earlier, but I used to meet people and evaluate them and think of them in total. I would say a faculty member, he or she is a great clinician, but they don't do research. And somehow the fact that they didn't do research influenced my total view of the person. But when I became chair, I changed my philosophy, and I appreciate the things that people do, and I worry less about what they don't do. If someone's a great clinician, I celebrate that. If they're a great teacher, I celebrate that. And they don't have to be all things to all people for them to really enhance the value of the department. And I think that's been really a sea change for me, and I think it really has allowed me to fully appreciate the great faculty that we have.
I think that's such a great point because right now in medicine, I think it's almost pushed upon that you should be great in every aspect, whether it be like research or in courses or medicine clinic itself. And if you have a calling or you have a really big passion for one of those aspects and you're really great at one of those, why not just really put all your efforts into that? With over 550 publications, what research topic or paper are you most proud of and why?
Well, that's a tough question. I think that I approached research and publications in a kind of a global way. And I really had two main areas of work. One has been in wound healing. And I really wanted uh, my work to focus on understanding how uh, the healing occurs and then bringing therapies or studying therapies to advance care for patients. And that has been kind of my kind of big picture approach. And so all of the work in that area has been is part of the story I'm trying to tell. And I also have a PhD in epidemiology, and one of the focuses has been understanding how dermatologic care has been delivered and improving the delivery of dermatologic care. Um, Most of the care for the skin is not given by dermatologists. It's given by other healthcare providers or practitioners. So improving their care, understanding and improving it, has been one of the things I've done over my career. And again, work in that area has also been very rewarding for me.
I'm so glad you brought that up because that's actually one of the reasons why, not to talk about the app, but that's actually one of the reasons why I wanted to start the app, because often people or patients are seeing their primary care provider or other provider, and they may not have the background that a dermatologist has. So having some more tools or your experience in teaching all the different physicians that are not having the dermatology background, your lessons or tools that you may have, is very helpful to give patients the best care possible. So really
Yeah, most doctors who are in practice, if they're not dermatologists, really have had very little training in dermatology, either in medical school or even in their residency. So having tools to improve their accuracy is critical because they still see the patients. They still make diagnosis or make referrals, and giving them the opportunity to be more accurate is very, very important.
we had a brief camera cut just to fix the angle, but we'll continue now. Next question. What advice would you give to medical students or residents considering a career in academic dermatology?
I think the critical word you use is career. And I think that if you view what you're doing as a career and not just a job, it really kind of expands your mind. I love academic medicine. I love academic dermatology because you get to use more of your skills. As a clinician, you're using one skill, which is taking care of patients. But in academics, you get to do lots of things. You get to educate on a regular basis. You get to discover and innovate or do research. You get to train the future generations of physicians and scientists and students, those going in your specialty and those going into other specialties. And as a chair, I get to help lead the health system and also get to serve as an administrator. So it really capitalizes on a lot of different skills. And I will tell you that in academic medicine, I've never had a boring day. Sometimes I wish I had a boring day, but I've never had a boring day.
Yeah, of course, I'm sure you get a ton of emails every day. So it's definitely never going to be boring here. Actually, I think this is a question they've actually touched on a little bit, but maybe if you want to expand on it a bit more. What role do you believe public health and epidemiology should play in dermatologic research and care delivery?
So it turns out that skin disease is prevalent. Close to 10% of all visits for everything is due to skin complaints.
Wow.
So it's huge. During, as an example, Vietnam War, there were more time lost to servicemen for skin problems than any other issue whatsoever. So skin disease is prevalent. It's actually costly, and it really affects patients' quality of life in a major way. Beyond that, if you have a skin problem, everybody can see. You can't hide your skin problem if it's on your face or on your arms or hands. It's evident to everybody. Well, you don't know if somebody has hypertension or kidney disease. And because of that, people with skin disease, when they go out into the workforce, their salaries are lower than a similar person without skin disease. There's a bias towards people with skin disease, and all of those come to the idea that studying, understanding, evaluating, and treating skin disease is critical. But it starts with a kind of a understanding of the distribution and the determinants of various skin problems.
That's interesting. I've never heard that. those with skin disease have a lower salary. That's interesting.
Yeah, it's a bias that we all have. It's an unconscious bias, probably to most, but it's probably baked into the human psyche, and so yes, we could try to change that in people, but I rather just help their skin.
What motivates you to continue pushing boundaries in your work after such a successful and long-standing career?
I guess that's a nice way of you calling me old, but I'll take that. No, but thank you. But I think that at each point in your career, you have different goals and motivations. Um, when you're young, you're trying to get as much knowledge and be as the best you possibly can be uh, uh, in what you do on a daily basis. Then you try to advance care, advance science. Now, my major goal is to try to help build the environment that other people can be successful. In our department, we have a term called uh, sustained excellence. And what I'm trying to do is to create a department that can weather storms that occur, whether it's research funding or changes in reimbursement. I want our faculty to be able to succeed, and so that that creating that environment is really important for me, so that the department can succeed. Beyond that, in outside of the department, but in the world, I also like to try to do that by helping organizations. The American Academy of Dermatology, which I served as vice president about a year or so ago, it allowed me the opportunity to not just help the people that I know here in Miami, but the whole dermatology community. And what happens is by making the dermatology community stronger, the result is patients do better. If you have a healthy, well-functioning group of dermatologists, the patient care is going to be better, and really, that's the goal.
Yeah, and one thing I've noticed so far attending some of these conferences is how close everyone is. A lot of the dermatologists, doesn't matter if you're from Florida, from California, across the country, they all know each other and they share, tips or advice. And I think that's really great.
Yeah, dermatologists make up about 1% of all doctors. It's a relatively small community. And obviously, we have, even if you're from Alaska or Florida, you have much more in common than you might have with other specialties or other professions. So we tend to gravitate towards each other. We like each other. We have kind of think about the world in similar ways. So it's really a great, great community.
Is there a guiding philosophy or principle you follow in both medicine and leadership?
If I was running for political office, I would say I have 2 points. And one, I believe in hard work and second chances. So I'm a big believer in that there's no such thing as an easy path to success. So I've worked hard. I try to lead by example. I try to never regret not having done something. If I fail at something and I've done my best, then that's okay. It wasn't meant to be. But never wanted to say, what if? What if I would have worked harder or done something different? So I think that's part of that philosophy. The second is second chances. And we encounter people who have challenges, a variety of challenges. Some they have no fault of their own, and other times people make mistakes. But I don't think that a single mistake that a person makes should necessarily scar them for the rest of their lives. So I think the idea of if somebody makes a mistake, we want to give them the opportunity to make up for it and give them a second chance at success.
That's so refreshing to hear, because I think a lot of my followers, I've gotten a lot of questions from them, and it's always been like, oh, I've done really bad on my MCAT the first time, or I have a really bad GPA my first freshman year of college. Like, will I ever get into medical school? And as the chairman of the department, it's very nice to hear that you always have a second chance. Seeing improvement is great. I know for me, my first round on the MCAT, I didn't do as well as I'd hoped at all. And I share this on my platform a lot. I just studied hard, do as much as you can, and you'll go up from there.
Yes, exactly.
Last question is a fun bonus question. If you weren't a dermatologist, what would you be doing?
Well, secretly, I'd like to be a surfer, but since I don't know how to surf, that's not probably the right answer. But my father was a school teacher and a basketball coach, and I played basketball. Actually, I played basketball in college. When I was younger, I got a scholarship to college. So I would imagine that I might have been a coach of some sort.
That's very cool. Basketball. I mean, here, have you gone to any of the Heat games?
Oh, sure. Yep.
Yeah, I went to one like beginning of medical school, and that was a lot of fun.
In fact, one of my father's old players was one of the founding owners of the Miami Heat, a fella who's now kind of lost in a lot of people's memories, but a fellow named Billy Cunningham, who played at University of North Carolina and played in the NBA and the ABA, was the All NBA, and was the coach of the Philadelphia 76ers, was one of the founding owners of the Miami Heat back in I guess 1980s.
Wow, very cool. Yeah. What a full circle.
Yes.
Well, Dr. Kirsner, thank you so much for joining me and answering some of these questions. If you all have any more questions or have any comments, feel free to leave them down below.
Thank you very much for allowing me to participate in this.